So how are you with figuring out if someone is in respiratory or metabolic acidosis and if they're compensated or not? All right, so we have Carl, an elementary student, was rushed to the hospital due to vomiting and a decreased level of consciousness. The patient shows slow and deep Kussmaul breathing, and he is lethargic. He is lethargic and irritable in response to stimulation. He appears to be dehydrated. His eyes are sunken and mucous membranes are dry, and he has a 2-week history of what? Polydipsia, polyuria, and weight loss. Measurement of arterial blood gases, what we have? pH of 70, PO2 of 90, CO2 of 23, HCO3 of 12. Other results: sodium 126, potassium 5, and chloride 95. What is your assessment? So we have in this question, we have someone that's come in, some keywords in here, you guys. He's an elementary student, vomiting, decreased level of consciousness. Always want to keep those in your keywords. Kussmaul breathing, lethargic, irritable, polyuria, polydipsia, and weight loss. So you want to get an idea of what this sounds like to you, because that's going to help you figure out what's going on. So we have to decide if he's in respiratory acidosis, uncompensated acidosis, respiratory partially compensated, metabolic alkalosis, uncompensated, or metabolic acidosis, partially compensated. So what you're looking at here, in order to figure out if it's what kind of state he is in, we're going to look at the pH, right? Number one, we have to know that's normal. We're going to look at, if that's normal, we're going to look at the CO2, and we're going to look at the bicarb. So go ahead, and I at least gave you that hint. Go ahead and pause and decide what's your answer, then come back. All right, so we're back, and we have, again, this patient that's having all these symptoms, right? Polyuria, polydipsia, polyphagia, weight loss. I'm sorry, not polyphagia, polyuria, weight loss, and polydipsia, and Kussmaul breathing. That's more of type 1 diabetes. He's in elementary school. Remember, usually type 1s, individuals that are young have type 1 diabetes. There are some who are getting it in their older and 40, but we have a young client, and this is diabetic ketoacidosis. So I know just from that, he's in a metabolic acidotic state, because his body, you know, in diabetes type 1, if they don't have enough insulin on board, the body starts breaking down fat and protein. Fat, byproduct of fat, is ketones, and that can make their blood really acidic, if you will, metabolic acidosis. All right, so pH is that normal or abnormal? It's abnormal. It's 7. Normal 7.35 to 7.45. He is acidotic. That's the state. So now I got to figure out which one is it. Is it metabolic or respiratory? CO2 is 23, and we know CO2 is 35 to 45. 45 is higher if they're acidotic, right? If they're acidotic, it's going to be higher than 45. They're alkalotic. So CO2 is alkalotic. HCO3, normal is what? 22 to 26. They are acidotic, right? Because in an alkalotic state, they would be greater than 26. So pH is acidotic as well as HCO3. That tells me they're in metabolic acidosis. Both of them are aligned with each other. Now we have to figure out if it's uncompensated, partially, or compensated. So we're looking here. If it's going to be partially compensated, all 3 lab values are going to be abnormal. And in this case, we do have that. If it is fully compensated, which that's not an answer, fully compensated means that the pH is normal. And then if we have uncompensated, that means that one of either CO2 or HCO3 is abnormal. So here we go, partially compensated, because all 3 lab values are abnormal. And you can find out more about that method, tic-tac-toe, on Nurses Labs. I'll talk to you guys soon. Take care of yourself.